Welcome to Men's Health 365. Today we're addressing one of the most frustrating yet rarely discussed problems that men over 60 face: incomplete bladder emptying. If you find yourself constantly feeling like you haven't fully emptied your bladder, if you're returning to the bathroom 15 minutes after urinating because you still feel the urge, if you're experiencing weak urine stream or dribbling, you're not alone and you're not imagining it. This affects the majority of men over 60 to some degree. But here's what most doctors don't tell you. The root cause of incomplete bladder emptying for many men isn't primarily your prostate, although that plays a role. It's actually a hidden nerve called the Pudendal nerve that controls bladder emptying. And when this nerve isn't functioning properly due to compression, damage, or poor coordination, you can never fully empty your bladder no matter how long you stand there. If you're watching this video, hit that subscribe button right now. We share evidence-based health strategies specifically for men over 60 every single week. Also, drop a comment below telling us which country you're watching from. We love seeing our global community grow. Let me share Edwin's story. Edwin is a 69-year-old retired airline pilot from Denver, Colorado. For over 4 years, Edwin dealt with progressively worsening urinary symptoms that were destroying his quality of life. He constantly felt like his bladder wasn't empty, even immediately after urinating. He had to urinate again within 20 to 30 minutes despite feeling like he'd tried to empty completely. His urine stream was weak and would start and stop multiple times. He experienced significant post-void dribbling, requiring him to wear pads to avoid embarrassing wet spots. Nighttime was even worse, with Edwin waking 5 to 6 times per night to urinate. The chronic sleep disruption left him exhausted, irritable, and unable to enjoy activities he loved. Edwin's urologist performed comprehensive testing, including prostate exam, PSA testing, and post-void residual measurement with ultrasound. The results were puzzling. Edwin's prostate was only mildly enlarged, not enough to explain his severe symptoms. His PSA was normal. However, the post-void residual showed he was consistently retaining 150 to 200 milliliters of urine after attempting to empty completely. Normal retention is less than 50 milliliters. Edwin's bladder was only emptying about 60% with each void. The retained urine meant his bladder filled quickly, causing frequent urgent trips. His urologist initially prescribed an alpha blocker medication to relax the prostate, but it provided minimal improvement. Frustrated and desperate, Edwin sought a second opinion from a pelvic floor physical therapist who specialized in male urinary dysfunction. This therapist took a completely different approach, examining Edwin's pelvic floor muscles and assessing his pudendal nerve function. The therapist discovered that Edwin had significant pudendal nerve dysfunction, likely caused by years of prolonged sitting during his pilot career combined with chronic pelvic floor muscle tension. The therapist explained that the pudendal nerve, which most people have never heard of, is actually the master controller of bladder emptying. When this nerve doesn't function properly, complete bladder emptying becomes impossible. The therapist designed a comprehensive treatment program targeting pudendal nerve function and pelvic floor coordination. Within just 3 weeks, Edwin noticed improvements. His urine stream became stronger. Within 6 weeks, the constant sensation of incomplete emptying had decreased significantly. Within 12 weeks, post-void residual testing showed Edwin was now retaining only 30 milliliters within normal range. He was emptying his bladder 95% completely. Nighttime urination decreased from 5 to 6 times to 2 times, and sometimes only once. Today, at 69, Edwin has regained his quality of life. He sleeps well, travels confidently, and no longer lives in constant anxiety about bathroom access. What did Edwin's therapist teach him about the pudendal nerve? Critical information we'll cover in complete detail in this video. Before exploring solutions, let's understand the pudendal nerve, its function, and why it's so critical for bladder control. The pudendal nerve is a major nerve in your pelvis that most people never learn about despite its profound importance. It originates from spinal nerves S2, S3, and S4 in your lower spine, travels through your pelvis and branches extensively to innervate multiple critical structures. The pudendal nerve provides motor control, meaning it triggers muscle contractions, to the external urethral sphincter, the muscle you consciously contract to stop urinating, the bulbocavernosus muscle, which helps expel the last drops of urine and also contributes to erections and ejaculation and other pelvic floor muscles, essential for bladder and bowel control. The pudendal nerve also provides sensory information from your genitals, perineum, and anal area, allowing you to feel when your bladder is full and providing the sensation that lets you know when you've finished urinating. Most importantly, the pudendal nerve coordinates the complex process of urination. Urination isn't as simple as just releasing urine. It requires precise coordination. First, your brain sends a signal to relax the external urethral sphincter, the voluntary muscle you control consciously. Second, the detrusor muscle in the bladder wall contracts to push urine out. Third, the pelvic floor muscles, particularly the bulbocavernosus, contract in a coordinated wave to expel all remaining urine from the urethra. The pudendal nerve orchestrates this entire sequence. When the pudendal nerve is compressed, damaged, or not functioning optimally, several problems occur. The external sphincter doesn't relax fully, creating resistance that prevents complete emptying. The pelvic floor muscles don't coordinate properly, failing to generate the strong contractions needed to expel all urine. Sensory feedback is impaired, so you don't accurately feel when your bladder is truly empty. The result is incomplete bladder emptying, weak stream, post-void dribbling, and frequent urgent urination as your bladder fills from the retained residual volume. Several factors damage or impair pudendal nerve function in men over 60. First, prolonged sitting, particularly on hard surfaces or bicycle seats, compresses the pudendal nerve as it travels through a narrow space between pelvic bones and ligaments called Alcock's canal. Cyclists commonly develop pudendal nerve problems, but anyone who sits for long periods is at risk. Second, pelvic trauma from falls, injuries, or surgery can damage the nerve. Third, chronic constipation and straining during bowel movements repeatedly stretches and stresses the nerve. Fourth, chronic pelvic floor muscle tension, often from stress, creates pressure on the nerve pathways. Fifth, diabetes causes peripheral neuropathy that affects all nerves, including the pudendal nerve. Sixth, aging itself causes some degree of nerve degeneration. The good news is that unlike some nerve damage that's permanent, pudendal nerve dysfunction is often reversible through specific interventions targeting the nerve and surrounding structures. Research published in the International Urogynecology Journal found that conservative treatments for pudendal nerve dysfunction, including physical therapy, lifestyle modifications, and specific exercises, produce significant improvements in urinary symptoms in over 70% of patients. Now let's explore the comprehensive approach to restoring pudendal nerve function and achieving complete bladder emptying. The first strategy is pelvic floor muscle training, but not standard Kegels. Traditional Kegel exercises that focus only on contracting pelvic floor muscles can actually worsen incomplete emptying if your pelvic floor is already too tight. What's needed is learning both to contract and, more importantly, to fully relax your pelvic floor muscles. This is called pelvic floor coordination training. Start by identifying your pelvic floor muscles. These are the muscles you use to stop urinating midstream or to prevent passing gas. However, don't regularly stop urination as a practice method, as this can cause problems. Once identified, practice conscious relaxation. Sit or lie comfortably. Take a slow, deep breath. As you exhale, consciously relax your pelvic floor muscles. Imagine them releasing downward and outward, like opening a flower. You might feel a gentle dropping sensation in your perineum, the area between your genitals and anus. This is reverse Kegel or pelvic floor drop. Hold this relaxed state for 10 to 15 seconds while breathing normally. Repeat 10 times. Practice this 3 times daily. This teaches your pelvic floor to release fully, which is essential for complete bladder emptying. Once you can reliably relax your pelvic floor, practice during urination. When you begin urinating, consciously perform a pelvic floor drop, relaxing these muscles completely. This allows maximum urine flow. Then, at the very end of urination, perform a strong pelvic floor contraction, squeezing firmly for 5 seconds. This contraction uses the bulbocavernosus muscle to expel the last remaining urine from your urethra, preventing post-void dribbling. Release and relax completely again. This two-phase technique, relaxation during urination followed by strong contraction at the end, is one of the most effective methods for achieving complete emptying. The second strategy is Pudendal nerve gliding exercises. Just as nerves in your arm can be mobilized through stretches, the Pudendal nerve can be mobilized to reduce adhesions and compression. Nerve gliding exercises gently move the nerve through its pathway, promoting blood flow, reducing scar tissue, and improving function. Here's a simple Pudendal nerve glide. Lie on your back with knees bent and feet flat on the floor. Take a deep breath. As you exhale, tilt your pelvis backward, flattening your lower back against the floor. Simultaneously, tuck your chin to your chest. Hold for 5 seconds. As you inhale, return to neutral position, allowing your lower back to arch slightly and lifting your chin. Repeat this pelvic tilt with spinal flexion and extension 10 to 15 times. Another effective glide. Lie on your back. Bring both knees toward your chest, grasping behind your thighs. Gently pull your knees closer to your chest until you feel a stretch in your lower back and buttocks. Hold for 30 seconds. Release and repeat 3 times. This position opens the space in the pelvis where the Pudendal nerve travels, reducing compression. These nerve glides should be performed daily for best results. Research shows that nerve mobilization exercises improve nerve conduction and reduce symptoms of nerve compression. The third strategy is addressing Pudendal nerve compression points through positional changes and cushioning. The Pudendal nerve can be compressed at several points along its pathway, particularly where it travels between pelvic bones. Prolonged sitting on hard surfaces is a major contributor. The solution involves using proper cushioning and changing positions frequently. Invest in a coccyx cushion or donut-shaped cushion with a cutout in the center. This removes pressure from the perineum, where the Pudendal nerve is closest to the surface. Use this cushion whenever sitting for extended periods, in your car, at your desk, or at the dinner table. Limit continuous sitting to 30 to 40 minutes maximum. Stand up, walk around briefly, and stretch. This relieves pressure on the nerve and promotes blood flow. Avoid sitting on hard surfaces like wooden benches or metal bleachers. Always use cushioning. If you cycle, ensure your bike seat is properly fitted and consider a seat specifically designed to reduce perineal pressure. Many cyclists develop Pudendal nerve problems from poorly fitted seats. Consider standing desks or adjustable desks that allow you to alternate between sitting and standing throughout the day. These positional strategies reduce chronic compression that damages nerve function. The fourth strategy is treating chronic constipation if present. Chronic straining during bowel movements repeatedly stretches and damages the Pudendal nerve. If you regularly strain or have hard stools, addressing this is critical. Increase dietary fiber gradually to 25 to 30 grams daily through vegetables, fruits, whole grains, and legumes. Drink adequate water, 8 to 10 glasses daily, as fiber without water worsens constipation. Consider a fiber supplement like psyllium husk if dietary fiber is insufficient. Use a squatty potty or footstool to elevate your feet during bowel movements. This changes the anorectal angle, making elimination easier and reducing straining. Never ignore the urge to have a bowel movement, as delaying allows stool to become harder. The fifth strategy is deep breathing and stress reduction. Chronic stress causes chronic pelvic floor tension, which compresses the Pudendal nerve and impairs its function. Deep diaphragmatic breathing directly relaxes the pelvic floor. Practice this technique. Sit or lie comfortably. Place one hand on your chest and one on your abdomen. Breathe in slowly through your nose for a count of 4, allowing your abdomen to rise while your chest remains relatively still. Hold briefly. Exhale slowly through your mouth for a count of 6, feeling your abdomen fall. As you breathe, consciously focus on relaxing your pelvic floor with each exhale. Perform this breathing exercise for 5 to 10 minutes daily, particularly before bed or during stressful moments. Over time, this retrains your nervous system to maintain a more relaxed baseline state, reducing chronic pelvic floor tension. Additionally, implement stress management practices like meditation, progressive muscle relaxation, gentle yoga, or Tai Chi. These practices reduce overall nervous system arousal, which directly affects pelvic floor tension and pudendal nerve function. The sixth strategy is optimizing vitamin B12 and B complex vitamins. The pudendal nerve, like all nerves, requires adequate B vitamins for proper function and repair. Vitamin B12 is particularly critical for nerve health. 12B deficiency is surprisingly common in older adults due to reduced stomach acid production and absorption problems. 12B deficiency causes peripheral neuropathy affecting all nerves, including the pudendal nerve. Get your B12 level tested. Optimal levels are above 400 picograms per milliliter, though labs often consider anything above 200 normal. If deficient, B12 supplementation or injections can dramatically improve nerve function. Even if not deficient, supplementing with a B complex vitamin ensures adequate intake of all B vitamins, essential for nerve health, including B1, B6, and B12. Look for methylated forms like methylcobalamin for B12 and pyridoxal 5-phosphate for B6, as these are more bioavailable. Alpha-lipoic acid is another supplement with good evidence for supporting nerve function and repair. Typical doses range from 300 to 600 milligrams daily. Discuss supplementation with your doctor, particularly if you take medications, as some interactions are possible. The seventh strategy is the double void technique for more complete emptying. This simple behavioral technique can immediately improve your emptying, even before nerve function fully recovers. After urinating normally and feeling finished, wait 30 to 60 seconds, then attempt to urinate again. Often, a significant additional amount of urine will come out. This second void empties residual urine that didn't fully evacuate during the first attempt. The double void technique is particularly effective when combined with pelvic floor relaxation and end of void contraction we discussed earlier. While urinating the second time, lean forward slightly, placing your elbows on your knees. This position uses gravity and changes the angle of your urethra, promoting more complete emptying. The eighth strategy is working with a pelvic floor physical therapist if available. These specialized therapists can perform internal examination to assess pelvic floor muscle tension and coordination, provide hands-on manual therapy to release trigger points and reduce muscle tension, teach proper pelvic floor exercises specific to your individual dysfunction. Use biofeedback to help you learn proper muscle control visually and provide electrical stimulation or other modalities to improve nerve function. Not all physical therapists have this specialized training. Look for therapists certified in pelvic floor rehabilitation. Many men are initially uncomfortable with the idea of pelvic floor therapy, but it's highly effective and professional. Research shows that men who work with pelvic floor therapists achieve faster and more complete improvement compared to self-directed therapy alone. The ninth strategy is considering medication adjustments, if appropriate. Many medications worsen urinary retention and incomplete emptying. Antihistamines, particularly first-generation ones like diphenhydramine, decongestants containing pseudoephedrine, some antidepressants, particularly tricyclics, opioid pain medications, and medications for overactive bladder, paradoxically, can worsen retention in some men. Review your medication list with your doctor. If you take medications known to impair bladder emptying, discuss alternatives or dose adjustments. Sometimes medication changes alone produce dramatic improvements in urinary symptoms. The 10th strategy is treating underlying conditions if present. Diabetes with poor blood sugar control causes diabetic neuropathy affecting all nerves. Optimizing blood sugar through diet, exercise, and medication protects nerve function. Vitamin deficiencies beyond B12, including vitamin D and folate, can impair nerve health. Comprehensive nutritional optimization supports nerve repair. Obesity, particularly abdominal obesity, increases pressure on pelvic structures and nerves. Weight loss often improves urinary symptoms significantly. Sleep apnea causes chronic oxygen deprivation that damages nerves. Treatment with CPAP improves nerve health throughout the body. Let's return to Edwin's story. His pelvic floor physical therapist implemented a comprehensive 12-week program. Weeks 1 through 3 focused on teaching Edwin proper pelvic floor relaxation and the two-phase urination technique. He practiced pelvic floor drops daily and implemented the technique every time he urinated. He started using a coccyx cushion at work and in his car. On weeks 4 through 6, added Pudendal nerve gliding exercises performed daily, deep breathing practice for 10 minutes before bed, and the double void technique. Edwin noticed gradual improvements in stream strength and post-void sensation. 7 through 9 weeks introduced manual therapy sessions where the therapist performed internal pelvic floor release, addressing tight trigger points, compressing the pudendal nerve. Edwin also started taking a B-complex vitamin and alpha-lipoic acid for nerve support. Weeks 10 through 12 focused on maintenance and progressing exercises. By week 12, Edwin's post-void residual had decreased from 175 milliliters to 30 milliliters. His urinary frequency decreased from every hour to every 3 to 4 hours during the day. Nighttime urination decreased from 5 to 6 times to 1 to 2 times. Most importantly, the constant feeling of incomplete emptying had resolved. Edwin felt confident that when he urinated, his bladder was truly empty. Today, Edwin maintains his practices. He continues pelvic floor exercises daily, uses proper cushioning when sitting, practices the two-phase urination technique, and sees his therapist every few months for maintenance. His quality of life has transformed completely. He travels confidently, sleeps well, and no longer lives in constant anxiety about bathroom access. Will every man achieve Edwin's results? Individual responses vary based on severity of pudendal nerve dysfunction, presence of other complicating factors like significant prostate enlargement or bladder muscle weakness, consistency of implementing techniques, and overall health status. However, research consistently shows that addressing pudendal nerve function produces meaningful improvements in the majority of men with incomplete bladder emptying. Even modest improvements, reducing post-void residual from 200 milliliters to 100 milliliters, significantly improve urinary frequency and quality of life. If you're over 60 and struggling with incomplete bladder emptying, start implementing these strategies today. Begin with pelvic floor relaxation exercises, practicing 3 times daily. Implement the two-phase urination technique with every void, relaxing during urination and contracting strongly at the end. Start daily Pudendal nerve gliding exercises. Use proper cushioning when sitting and limit continuous sitting duration. Address constipation if present through fiber and hydration. Practice deep breathing for stress reduction. Consider B-complex and alpha-lipoic acid supplementation after discussing with your doctor. Implement the double void technique. Review medications with your doctor for potential contributors. Give these interventions at least 6 to 8 weeks of consistent implementation before fully evaluating results. Nerve healing and pelvic floor retraining take time. Track your progress through symptoms and, if possible, post-void residual measurements. If you implement all strategies consistently for 12 weeks and see no improvement, or if symptoms worsen, consult a urologist for comprehensive evaluation. Severe bladder outlet obstruction from enlarged prostate may require medical or surgical intervention. However, even men requiring medication or surgery benefit from addressing pudendal nerve function and pelvic floor coordination. Before we wrap up, hit that subscribe button if you haven't already. Drop a comment below telling us which country you're watching from. To summarize, the pudendal nerve controls bladder, emptying through motor innervation of the external urethral sphincter and pelvic floor muscles, sensory feedback about bladder fullness and emptying completion, and coordination of the complex urination sequence. Dysfunction causes incomplete emptying, weak stream, post-void dribbling, and urinary frequency. Comprehensive restoration involves pelvic floor coordination training with both contraction and relaxation, Pudendal nerve gliding exercises to reduce adhesions and compression, addressing compression points through proper cushioning and positional changes, treating constipation to prevent nerve stretching, deep breathing, and stress reduction to decrease pelvic floor tension, B vitamin and alpha-lipoic acid supplementation for nerve support, double void technique for more complete emptying, pelvic floor physical therapy for specialized treatment, medication review and adjustment, and treating underlying conditions like diabetes. Edwin's story demonstrates that even severe incomplete emptying can improve dramatically through comprehensive pudendal nerve-focused interventions. The pudendal nerve is truly the hidden master controller of bladder function, yet most men have never heard of it. Understanding and addressing this critical nerve can transform urinary function and quality of life. Thank you for watching Men's Health 365. We'll see you in the next video.